These last few months, it's been impossible to escape news and updates about COVID-19, also known as the novel coronavirus. While it's incredibly important to stay informed, maintain social distancing, and wash your hands, there's also been plenty of fear-mongering, exaggeration, misinformation, and sensationalism around the disease. Today, we're going to discuss what it's actually like to have the disease in terms of cold, hard facts, no spin or editorializing. All the information in this video is current as of March 21st, 2020, and because this is a situation developing extremely quickly, we also encourage independent research. All the information we're presenting in this video comes directly from the US Centre for Disease Control, the UK National Health Service, and the World Health Organization, as well as official scientific studies. We recommend also using these reliable sources if you wish to stay informed. COVID-19 is a respiratory illness, meaning it attacks the lungs and the airways. If you've caught COVID-19, it'll be as a result of contact with another infected individual. For your first week to 2 weeks of infection, you may not display any symptoms whatsoever, which is why exercising caution is so extremely important during this period of time. Some people will actually remain asymptomatic, meaning they display no actual symptoms throughout the course of their infection. Two studies, one published in the journal Emerging Infectious Disease, and another that was a collaboration between Kyoto, Oxford, and Georgia State University, settled on the possibility that around 17.9% of people suffering from COVID-19 will remain completely asymptomatic. If you happen to fall within this category, you're at the least risk of developing the more severe form of the disease or undergoing serious health complications. However, it's worth noting that being asymptomatic actually puts you at far greater risk of infecting others through a lack of caution. This is why, even if you think you're not infected, it's positively vital to maintain good hygiene and social distancing. Interestingly, the majority of asymptomatic cases appear to be in children, with 90% of the cases of pediatric coronavirus in China being asymptomatic to mild. While the grand majority of people who contract COVID-19 will display symptoms, a large chunk of these people will only experience a mild cold or flu-like virus. According to datasets from China, around 80.9% of the cases were mild. If you're lucky enough to fall into this category, and statistically you're likely to be relatively young and healthy with little to no chronic underlying health conditions, you're most likely to experience fever and a severe cough. It definitely won't feel good, but you won't be under any serious threat of death from what you're experiencing. In a lot of cases, the disease tends to run its course within a 3-week period, from an incubation period that tends to last from 5 days to 2 weeks, and symptoms that present for around 5 to 7 days before the sufferer begins to recover. Once again, if you find yourself in this position, the generally accepted advice is to contact and inform your doctor if possible, remain isolated, maintain good hygiene, eat and stay hydrated, and treat issues like pain symptomatically with safe over-the-counter medication. According to data gathered from the Chinese outbreak, it appears to have remained consistent for the world at large. Around 13.8% of the cases appear to present severe health issues for the sufferer. These sufferers are likely to be older than 50 and suffer from underlying health conditions like severe respiratory issues, diabetes, high blood pressure, cancer, and cardiac illnesses. However, it's important to note that there are always outliers. Young people and people without underlying health issues can occasionally experience severe symptoms, so don't use your age and health as an excuse to throw caution to the wind. Initially, people who experience a more severe case of COVID-19 will run the gamut of standard symptoms: high fever, coughing, shortness of breath, chest pains, breathing difficulties, and in some cases even headaches and digestive issues. However, the key difference between mild and severe cases is that severe cases are more likely to develop into a more serious infection of the lungs. Most commonly, people are at risk of developing pneumonia. Pneumonia is a dangerous form of bacterial lung tissue inflammation. The tiny air sacs in the primary bronchi, which are the tubes that connect the lungs to your trachea, become inflamed through infection and swell, causing severe breathing difficulties in sufferers. If you've been suffering from COVID-19 and the symptoms actually appear to worsen after 5 to 7 days of experiencing them, watch out for the telltale signs of pneumonia. These include rapid heartbeat, sweating and shivering, loss of appetite, chest pain, fatigue, joint pain, and in some severe cases, coughing up blood in one's phlegm. If you believe you have pneumonia, do not hesitate to contact a healthcare professional and get yourself to a hospital immediately. Pneumonia is a severe and life-threatening ailment and must be treated as quickly as possible to ensure best results. To avoid developing pneumonia from a case of COVID-19, the same rules apply. Prevention is more effective than treatment. Maintain social distance and good hygiene. Eat well, remain hydrated, and take extra precautions if you know yourself to be in one of the high-risk groups. Finally, according to the Chinese data, around 4.7% of the cases of COVID-19 developed into critically dangerous illnesses for the sufferers. While these cases are relatively rare, that's no reason to be any less cautious. People with critical conditions are the most likely to die from the illness. Death can occur from untreated pneumonia, severe acute respiratory disease, and sometimes even kidney failure. While, like the severe symptoms, this is the most common for people in the disease's risk groups, this can technically happen to anyone. And this is not an excuse to panic and do anything irresponsible or dangerous, just to maintain vigilance and caution. COVID-19 is still an incredibly new disease. Information evolves quickly as scientists learn more about the condition and its processes. It may feel scary, like we have no control over the situation, but the fact is that we have a lot of control over an extremely important factor here: our own actions. To do your part in both helping yourself and society combat this illness, maintain good hygiene and social distancing. Don't buy into or spread misinformation about the disease. Follow government guidelines and avoid things like panic buying. We as a society can get through COVID-19, but only if we're all sensible and responsible in our actions. For more information, the CDC and the World Health Organization are excellent sources. Thank you for watching this episode of the Infographic Show. Keep an eye on your feed for more information about COVID-19. And in the meantime, you can watch how to stay safe from the coronavirus COVID-19 and why new coronavirus COVID-19 could be deadlier pandemic than SARS. In the meantime, stay safe, stay indoors, and wash your hands.